This is Augusta DeLomo on January 14th, 2025 at 1:30 p.m., conducting an interview for the Global Oral History of PEPFAR project. To start, could you begin by introducing yourself and establishing your connection to PEPFAR and what years you worked on the PEPFAR
Sure,
project?
happy to do it. Great to meet you, Augusta, and my name is Colin McIff. I'm currently the Deputy Assistant Secretary here in the U.S. Department of Health and Human Services, and I was with PEPFAR from almost the beginning, or very early, from 2004, November 2004, until about April 2010. And then some of my subsequent jobs have still touched on PEPFAR, but that was when I was in the Office of Global AIDS Coordinator. I'm a career civil servant.
Could you start, Colin, by telling us a little bit about yourself and your family? Sure. Where were you born? Where did you go to school?
Sure.
Things like that.
Absolutely. I'm in mid-50s now, and I was born in Tucson, Arizona, went to undergrad at University of Arizona, and then to graduate school in UC San Diego for international relations. And my undergrad was in history, so I actually don't have a public health background. I'm coming at it much more from the diplomatic and kind of negotiator type of a role.
Well, as a person that got her undergrad and PhD in history, it's always great to have a fellow historian talking to us about these issues. Can you tell us about, how you got into diplomacy and sort of those early career years for you?
Sure, absolutely. So at the outset, I didn't know exactly when I was going to school whether I wanted to be in policy or actually go ahead and get a PhD and become a professional historian myself. And I decided, well, it would be interesting to do like my master's in policy and just try it out, and then it kind of stuck. And so, and actually, it's interesting for this project. I had an opportunity mid-year in my graduate school time to do an internship at the State Department, and I was placed in the Oceans, Environment, and Science Bureau. And my boss, as an intern in grad school, was a guy named William Dilday, who ultimately hired me into PEPFAR when that office was set up in 2004.
And so when this office is set up in 2004, obviously you're working before this appointment in PEPFAR. And I'm curious what your sense was of the pandemic before you started working on HIV. What did you know about HIV? What did you know about Africa? What was your background before you came into this work?
Yeah. So actually, if I've had any specialty in my career, it's really been in multilateral organizations. So when I was in Oceans, Environment, and Science, I actually did a lot of work at the UN General Assembly and in other UN organizations, and like the Convention on International Trade in Endangered Species and some of those things. When I was hired into so I knew that PEPFAR existed, and it was actually a lot through my boss / mentor, Bill Dilday. He had been. So there was a small office of HIV/AIDS at State, you may know, and have maybe talked to some of those colleagues prior to PEPFAR's existence. That was kind of, to be honest, a little bit of an afterthought within the Bureau that primarily focused on those big environmental issues, oceans issues. And that's actually where I was focused in my time, but I got the expertise in sort of multilateral organizations and negotiations and how to kind of do that work kind of effectively. And so then when Bill was brought into PEPFAR, and they needed basically officers who knew how systems worked. And so I was kind of brought in more for that. And then my multilateral work kind of, in a sense, shone through. And so then I shifted. I was initially brought in as like a special assistant to the coordinator, Randall Tobias, and doing just a lot of that kind of really important, but sort of behind the scenes management and organizational work. And then it came time for the HIV/AIDS special session at the General Assembly in 2006, and they really needed help, and I pitched in, and basically I then was kind of off to the races doing multilateral work, doing a lot of work with UNAIDS and WHO, and so that was kind of how it worked. But so PEPFAR was definitely my entree into global health, and I was brought in for that more organizational expertise, and I have become a health person, I guess, over time, since I've been in health ever since, really.
It feels like a story that we've heard from several people. We spoke with Ambassador Kolker earlier today, and he talked similarly of, he wasn't a global health expert, and then PEPFAR came to him and his experience through that. And I'm curious if you remember the launch at all or hearing about it at the State of the Union. There were people that were working on AIDS, as you said, in state that were focused on this, and even if the office was a little bit more sidelined. But do you remember the launch? Do you remember hearing about it?
So I do remember the State of the Union, absolutely, and noting it at that time. That was before I was in it. So I was just, in a sense, I was like aware of it because of some friends who were involved, and I knew, like, okay, this is like a big moment. And I more learned the lore of it from working with like Mark Dybel and of course Ambassador Kolker down the line, and learned how more, how they were able to pitch it to the White House and all of that. But I wasn't there at the very start, but it was sort of the end of the first year is when I joined, really.
Yeah.
Like I said.
And we'll dive into those years for you with PEPFAR. But to kind of set us up a little bit before we go in, I'm curious how you would explain PEPFAR to a layperson. What is the program? What does it do? Especially in those early years.
Yeah. I mean, I guess I would describe it as, and we often talked about it at this, like a Marshall Plan for Health. Right? I don't know if others have used that terminology, but we did use that terminology in those days. And I mean, it was a recognition. And it was kind of amazing because, it was absolutely an amazing thing to be able to be a part of, and such a privilege, because it was really the public health expertise was really driving that. There was clearly a lot of politics as well, including, in a sense, if I get, and this is just my personal take, right? But it's like, so, President Bush was often talked about his compassionate conservatism and all of that, but you had the Iraq War and all of that. And this is like his, in a sense, his proof of that. But he was also, in a sense, not going to just hit like a base hit. He was going for the home run, right? And so this was really that, and taking that program. And to give credit where it's due, I mean, as I came to learn, like there were a number of predecessor programs, right, including like prevention of mother-to-child transmission and some of the other like smaller programs, but to do the whole thing at that scale, of course, was just completely unprecedented.
And you told us a little bit about your mentor, who was the one that really brought you into PEPFAR. Yeah. Can you tell us a little bit about those series of events that led you into this role as multilateral organizations coordinator? Yeah.
So like I said, Bill Dilday had hired me in, and I was as a special assistant. So I was working in that role, and then Ambassador Kolker was brought in a little after I came in as well, and he was leading a lot of the work on the multilateral organizations as well. But the person who had been doing that work left. Like I think they were going to med school or something like that, and so they didn't have anyone who knew. I mean, this was another sort of amazing and very fun aspect of that work. It's probably the only time in my career where I've been associated with a program that's so directly, like, in a sense, presidential in nature. Like we existed in the State Department, but we didn't really follow State Department rules or anything, because it was like, well, if you have a problem with this, you can take it up with the president, and then so stuff just happened, right? Like, and it was pretty amazing in that regard. And so, but they still needed people who understood how like systems work. So like the General Assembly was happening. First Lady Laura Bush was going to be the head of delegation. She was calling for International HIV/AIDS Testing Day to be enacted to support the testing to allow for people to be put on treatment and all of that. And so they needed someone who knew UN systems, and I was there, and I was interested in moving, to be honest, like back out from the sort of behind the scenes roles into the more kind of diplomatic angle, and so I took that opportunity, and it really paid off, because within half a year after that high level meeting, we did have a resolution establishing International HIV Testing Day, and we worked with a number of the African countries on that, of course, and got to visit a few of them as well, Malawi and Tanzania later on.
You spoke about the kind of unique way that this program came about and really having presidential power and an interest behind it, and that you kind of got to operate in a way that didn't 100% follow state rules. And so could you tell us a little bit about this Office of the Global AIDS Coordinator? You know, how did it function? What were its main responsibilities, especially in those early days where you're basically building a program from the ground up?
Absolutely. And so there was an incredible, and I think, so there was a recognition that to build this program, well, first of all, you needed that technically sound aspect. So there was like a lot of reliance on CDC, but also when it came to like moving money and working effectively in country, you also need USAID. So we were in state, and the key and the key difference of it versus other things, I think, well, there was another contrast at the time, just to step back for a second, that we talked about a lot in those early days, contrasting PEPFAR to the Department of Homeland Security. Because with Homeland Security, right, they pulled out all of the pieces from the different departments and created this new giant beast. And I don't think that they necessarily thought that that was a good thing at the end of the day. And with PEPFAR, I think they were overtly trying, which came after that, as I recall, like they were overtly trying to say, okay, we're not going to like disrupt like CDC or USAID or NIH or whoever has work to do on this. We're going to leave folks in their agencies, but we're going to give the budget authority to the Global AIDS Coordinator. And that is the linchpin, right? Because since the Global AIDS Coordinator to this day has that budget authority, it ultimately comes down to them, and the agencies all have to ultimately, come into line. And so, and state was helpful in that sense because, or us being in state as the Global AIDS Coordinator was helpful because it was also neutral. I mean, and I'm sure you've heard a common through line is in terms of our internal divisions and I don't know, not but different creative differences, right, between like CDC and USAID. And in fairness, they have different missions, but it doesn't always mesh in terms of how programs should play out, let alone with the countries themselves. And so having the Global AIDS Coordinator at state allowed for that diplomatic muscle and leveraging the work with the countries at the ambassador level, so that the ministers of health as well, who were partners in this, like they knew that they had like strong, and authoritative partnership, and then at the same time, USAID could do their thing, CDC could do their thing. But ultimately, the responsibility is in the coordinator's office.
It's striking how you describe state as kind of able to use its diplomatic strings to negotiate these different priorities. And I'm curious how you saw, what did CDC want or hope for see as its strengths? And what about, the USAID? And what were the different, what were the approaches that they each wanted that you all were navigating?
Yeah, I mean, I think, and it changes over time somewhat, but I think, for CDC, many of those colleagues are more, sometimes even especially in those early days, maybe even embedded in ministries of health and much more closely aligned, in a sense, to the ministries of health. And they were focused on those really, really core public health aspects, whereas on the USAID side, and there's definitely expertise there, the Global Health Bureau and all of that, but they're much more focused on, moving the money and working with other partners, maybe development partners, on different aspects. So I think their missions are just different, like also, in a sense, I would say like USAID often has like a longer term view, but it's like a developmental view, whereas CDC is coming in and it's the public health, it's the surveillance, like it's the now, but it's also almost more of a peer-to-peer, right, relationship, since they're often working with their public health counterparts in the ministries.
And you coming in with your expertise and background in multilateral organizations, tell us a little bit about what it meant to be the officer of multilateral organizations.
Yeah. So it really, a lot of my time, most of my time, because there were other folks who were dedicated. The other big project along with PEPFAR was the Global Fund, right, and getting that up and running. HHS Secretary Thompson in the first Bush term was the chair of the Global Fund, and so there was a whole work around that, and getting the balance right between HIV, money, TB, and malaria, as well as that early decision to have U.S. resources leveraging other investments. Those, I think, were all really ultimately successful things that allowed the Global Fund to be successful over time. But where I focused in was on those UN bodies, so like UNAIDS in particular, and running our work with the governing bodies of UNAIDS, also WHO, and working with their HIV/AIDS program. The HIV testing day example. That's an example of where the work that I did, like there was that negotiating and diplomatic component in New York where we got a resolution adopted calling for International HIV/AIDS Testing Day. But then it would be working with CDC, and that's when I went on the visiting Malawi and Tanzania for their HIV testing days. It was interesting because we were working with WHO on their guidelines, and it was funny because, of course, the politicals, they're like, well, we've just told them they should do testing, but obviously the Tanzanian Ministry of Health or the Malawian Ministry of Health, like they want to know what WHO says, right? They're not, of course CDC is a good partner, but they're not just going to take orders from US CDC, right? And so this is helping. That was another part of in a sense, the diplomacy with my own leadership to help them understand, like, look, WHO helps you, and UNAIDS helps you because it gets everybody. It's not like we have different scientific approaches here. Everybody's got the same goals of what we're trying to do. It's just a matter of feeling that ownership, right? Because those other governments have ownership of WHO and of UNAIDS as well, and it's not just
The question of ownership that you brought up is a big one. And one of the things that we've heard from people who worked in the Bush administration are just talking about their plan with PEPFAR was the Bush administration did want a different approach, that they were skeptical of the Global Fund, that they wanted more American control. And I'm curious, as someone who is the multilateral officer sitting within this, if that was something you felt and how you try to approach this role with your mandate of partnership with a program that was designed to not be as partnering as it could have been.
Yeah, totally fair. And of course, the country operational plans were and are quite directive, and everything. Totally get all of that. I think, I guess it's maybe it's also nuances, but for example, when I was first there. In PEPFAR, it was still Peter Piot, the original director of UNAIDS, and Discoverable and all that good stuff. He, and I think we worked really well with them and with his successor, Michel Sidibe, as well. We worked very closely with them, and I think I guess what I would want to give them credit, especially colleagues like Mark Dybel and Jimmy Kolker, who realized that you can gain a lot of value and a lot of influence by just engaging a little bit constructive. A little goes a long way in the multilateral space, and so we could still push the things that we wanted to from a policy perspective and also work with them. I think the other thing I would just want to share on this, which was a key early piece of advice that you had asked about my previous engagements in Africa, and it wasn't really very much. I certainly, of course, did work with African delegations in my previous roles, prior to PEPFAR. But I remember when I first took on this multilateral role, one of the things Dr. Dybel always told me, he was like, when you go to the UNAIDS board, like listen to the Africans and follow them. Like this shouldn't be this UNAIDS board, even though we're funding, putting in the most resources into it shouldn't be a bunch of North Americans and Western Europeans talking about Africa. We should be listening to them in terms of what they need. And I tried very hard to follow that advice, and I think it actually helped me be successful in a lot of the different work that I had.
Are there things that you specifically remember, to your point about listening to the delegations from the continent, that you remember thinking, okay, these are real priorities for them that maybe we're not seeing, or maybe we need to reemphasize? Were there points where you saw, the differences in what was coming out of, WHO, these different delegations, UNAIDS, that felt different than where PEPFAR was coming from?
Yeah, I mean, well, it's of course, the some of the prevention messaging, especially early, was not necessarily what WHO on the whole what was it, ABC,
The ABCs,
right?
yeah.
The ABCs and all of that. But at the end of the day, and I give Mark Dybel, like Caroline Ryan, a lot of folks, the technical leads within the program, a lot of the credit for this. We did that. We did the needful, but we didn't push that to the exclusion of other things. And I think, and so at the end of the day, if that was viewed as useful for countries, like a country wanted to take that approach, like great. But if they had other things that they wanted to do, like we still remained throughout that whole time in the Bush administration the largest procurer of condoms. Even if we were talking about A and B first, and so I think that's some of it. I think there were other things that I was able to personally be involved in that supported. There was a discussion, and this was a big UNAIDS project on looking at on decriminalization of being, because some countries in those early stages had criminalized HIV status, and so including the United States, right? Well, or at least travel restrictions, and so reducing and eliminating those travel restrictions over time was something that I thought it was kind of good we were able to do, and especially in the transition. I feel like that was a good area where we set the groundwork in Bush, and then the Obama time, they actually just got rid of it. And so, yeah, anyway.
It's really striking how and I think you described it as, a little goes a long way in the international space. And the way PEPFAR has been described to us is it was a lot all of a sudden.
Yeah,
and so,
when
you think about that kind of initial reaction to PEPFAR, when you start this role, what did you see as how were the international organizations responding? What did they think about PEPFAR? What were kind of those early impressions? Were they worried about being sidelined? Were they excited about collaboration? What did that feel like in those early days?
Yeah, I think I think they had a lot of quibbles with specific things, but and we would get into that. But I think by and large, whether it was UNAIDS or WHO, for example, they were certainly just they couldn't believe that this was happening, and that someone was responding in this big of a way. And so I think at the end of the day, they were mostly well, we think if you did this, you might get better. And I mean, and I'm sure you've heard this, I think over time, and as it got into the later, Eric Gooseby and Debbie Burke's eras, the data and impact became more. In those early days, it was really, like you say, it was so much, and the curve was so steep. It was just kind of getting money out the door. Yeah.
What would you say, kind of again, as you mentioned, those early days, you're just trying to stop the flood, right?
Yeah.
And, how do you I guess, how do you make decisions about how to prioritize what you're focusing on when it just feels like the number of priorities is overwhelming, right? The numbers are staggering. People are dying and you're trying to prioritize. How do we start to chip away at a problem like this? So how did you approach that, especially from a multilateral perspective of what's the challenges where we're going to start?
And I feel like this is where it might be useful to talk about the country operational plans a little bit, because I feel like that was it's an incredibly heavy model. Like, let's not kid ourselves. Like, it's such an insane amount of work all the way from top to bottom, but it really did drive results, right? And one of the great things about it, and for me, so I have my, like, for 10 months out of the year, I'm doing my normal day job of working with WHO, working with UNAIDS, supporting Global Fund efforts, all those types of different things. But then in COP season, like, we would have these HQ like review teams that would be cross-sectional across all the subject matter areas and the technical teams on from testing, treatment, vulnerable populations, all of the different technical aspects you would imagine. And then there was a multilat reviewer as well that would bring in, and my job for those COPs, depending on the country, I would review that COP and be like, okay, well, here's, the WHO is, unfortunately, the WHO representative in this country is largely ineffective, so you can't rely on them. Or, oh, here, this country has a great, UNAIDS team, so really you should be listening to them, or, and so I was able to bring in those multilateral perspectives and those perspectives from those organizations and be listened to in the same way as the other technical teams. And then also, because I was covering the organizations, so that, I would work with the testing team when we were doing that, like and then also another UN organization I covered a lot during my time in PEPFAR fairly intensively, was actually UN Office of Drugs and Crime on harm reduction for injecting drug users. And so, and this going to directly answer your question. So I worked a lot with the vulnerable populations team as well for those issues, and for people who use drugs and all of that. And so there, the COPs would be really prioritized. So in a country, in the South Africa, you care about that, but you don't like focus on that because it's a much bigger issue. But then when you're looking at the country operational plan for Vietnam, or for other countries, Central Asian countries, you're like, oh, this is really an injecting drug use driven epidemic. So we really need to focus on harm reduction measures in that space. And once again, I felt like as long as the big picture political objectives were being met, like the leadership I would say across the board was very supportive, and more than supportive, insistent that it be data driven and technically driven in terms of what we were funding, in terms of the impact.
You described COPs as being like an incredibly heavy lift, and for someone who's coming to this fresh, that's not from, what is a COP? What goes into it? Why is it so challenging to do, and what's the benefit of doing it this way?
So it's in a sense, it's like the manifestation of the Bush administration's not trusting these other multilateral organizations, as you're saying, right? And so it's developed in each country, in each of the PEPFAR focus countries, and then beyond over time, right? You had these country operational plans, and I'll probably not get it exactly right because I'm a little bit removed. But
you don't have to write them anymore. You deleted them from the brain.
Exactly. So just with that caveat, it's basically how you're going to spend the PEPFAR resources in the coming year, and so. Big or small dollars, and it's down to the penny by category. Like, here's for this is the line for for prevention. This is the line for treatment. This is the line for orphans and vulnerable children, for marginalized populations, different campaigns, what have you. The ambassador at the post is involved, and the whole country team that works on PEPFAR is involved in first developing it and presenting it, working with the country. And then, as I said, then there's this review process, technical and policy review process at the HQ level to really go. So it's heavy in the sense that it's like literally like every dollar that's being spent in PEPFAR, and then the seniority level and the depth of involvement is from post all the way to headquarters is just massive. Yeah.
One of the things that Ambassador Kolker said to us when we were talking about his experiences when he was chief of mission in Uganda, was there was an incredible amount of discretion left up to the individual ambassadors to really decide, especially in those early years, what to do with the funding, how to bring this money into the hands of the organizations that they needed to. And I'm curious, as someone who's sitting in a different part of this apparatus but is seeing it, was that your sense about the level of discretion, or did over time it start to become a bit more formulaic of these are the things we've started to see that work, these are the kinds of things we want to see? What does that balance look like as PEPFAR matures? Yeah,
I think that it does get more data-driven over time. And I think not only that, but in the early years, it was that massive, just curve to really ramp up in spending. And then that hit the plateau, and then it's been in a sense, flat or shrinking since. And now on the upside, the advances have continued in medicine and other things, and we now know, you can get the viral load to de minimis levels and all of that, and so treatment is prevention and all of that, and so, I would say in those early years, I totally agree, and I think even going on the chief of mission is a critical position, especially for those key focus, countries. But over time, it got really intense, and then I know that over time there have been a lot of back and forths as well. And there sometimes in the COP season, as it were, there have had to be a lot of back and forths with the post to say hey, this can't really fly. We need to take a look at this again.
Yeah, when you're thinking about the funding, and you mentioned this earlier of, as the Bush administration is funding PEPFAR, they're still the largest procurer of condoms. That the money is being used for all kinds of things. And did you have a sense from your seat within these different multilateral organizations, what U.S. funding through some of them looks like in ways that was different or similar to PEPFAR?
Yeah, it's something. It's interesting. So I think in the early days, especially, there maybe wasn't as much coordination as one would hope. It was really just such a time of just kind of again getting things going. But over time, and actually even during the Bush administration, one of the opportunities I got to work with one of my predecessors here in Office of Global Affairs, Bill Steiger. I don't know if you've already talked to him or if you will, but certainly recommend it. But I worked with him closely on establishing basically a strategic plan with WHO. So there was quite a number. It's not the big number, but there was quite a lot of money ultimately flowing into WHO for different things, both at the headquarters level and in the regional offices and even country office level. But especially between CDC and USAID, there wasn't necessarily a coordination across the USG. And so what we did was we created basically a strategic plan, and we came in at leadership level with USG and WHO to say, okay, here's how we're going to fund. We're not trying to cut off the technical to technical collaboration, which is what generates so much good work and good outcomes. We want that to still happen, but in terms of how we're going to fund WHO and invest in WHO to support the HIV/AIDS response, that it's going to be a more organized way, and it's going to, we're going to decide that together. And so that actually, I think, was a really good model for how to kind of coordinate and rationalize the spending and the investments, so that also we can get the most out of them, right, and not be duplicative either internally or with other donors, because that the WHO could then say, well, the Brits are doing this, and so you guys can go over here, and that could work.
When you think about, as you said, not wanting to be duplicative and trying to get the most out of these services, one of the things that I'll say I've learned in the process of talking to so many people about PEPFAR and HIV is the problem of comorbidities, right?
Mm-hmm.
And that,
yeah.
Especially for WHO, sure. And they're focusing on the array of illnesses that can
Absolutely.
compound with HIV. And was that a focus that you felt like PEPFAR had at the beginning, or were you all kind of content to let the international organizations take the lead?
No, I would say that the TB, HIV/AIDS issues in particular were really, really front and center from the beginning. Now that might be one of the only ones. Like, it was later in the Eric Gooseby time, for example, where we, and then even later where we started to ask, okay, if people, Ambassador Gooseby always talked about that we've created these islands of excellence amid basically busted health systems. And so if people are getting their HIV medicines or having checkups, can they also be tested for hypertension and maybe get those meds if they need them, or diabetes or whatever. And so we started to look at those more systemic things. In the early time, I would say the main focus was really on the TB, HIV, because they're so deadly together.
And speaking again of this early focus, obviously PEPFAR had focus countries at the beginning.
Mm-hmm. Yes.
Were those identified before you started? Were those in the process? What was that? What was that like? Especially, again, you're working within the UN system, and I'm curious. I would imagine that a country would say, "I want to be a focus country," or "I do not." What was that? What was that like?
So most of them were selected by the time I had arrived, and of course with the focus on Africa. I think Vietnam was announced maybe shortly after I got there as the 15th focus country, which I think they really just wanted some geographical diversity, right? In fairness, but also this allowed for what we were talking about earlier in terms of the different prioritization of what prioritizing different interventions to look at different epidemic kind of profiles in a way. Yeah.
I realized I should have asked this sooner, but when you're sitting at this sea of multilateral organizations, could you give us a brief primer on when you're in this space, what is WHO's main sort of mandate and priorities? UNAIDS, UNICEF, UNDOC, what is each role trying to play in this space?
Right. So it's really different, and again, it does evolve over time. But WHO is challenging because they UNAIDS had to exist because they weren't doing their job in the 90s, right? And so then I think they improved in the 2000s certainly, and responded more effectively. And so WHO, of course, right there, the backbone with working with the health ministries at country level and focusing on the guidance, the technical guidance in particular, and some of the capacity building, not only on the direct things like HIV treatment, HIV prevention, but also on other relevant things like health workforce development and retention of health workers. That was another focus of during the time I was in PEPFAR, was on health worker training and retention, and we worked across on that. UNAIDS, the joint program, coordinated, did a lot of the functions within the UN system of the Global AIDS Coordinator, but very significantly without that budget authority. So they were not as successful in the coordination because of that. UN Office of Drugs and Crime, so they were focused really on harm reduction and people who inject drugs, and also on the criminalization issues and things like the travel measures. Their UN Development Program was another big partner within the joint program, and they manage the overall UN family at country level in many countries, developing countries, and then there were others as well. So it's like 15 agencies in total within the joint program. So not to go through all of them necessarily, but obviously UNICEF was a big factor. I'm sure Ambassador Kolker could talk a little bit about his time at UNICEF as well, leading the HIV program. So they each had a different slice, and mostly it's about capacity building and support for countries. Sometimes it's also about advocacy, like UNDP, for example. From the beginning, I think they took on a lot of the role. I mean, UNAIDS did this too to some extent, but a little bit the conscience of all of us around the human rights aspects and leaving no one behind and all of that kind of thing. They had a number of the colleagues at UNDP have been very passionate and effective on that.
One of the things I wanted to circle back to about some of the things maybe the multilaterals were not as thrilled about, and you mentioned the ABCs. And I'm curious, obviously PEPFAR was focused on testing, treatment, and prevention. And early on, the prevention part is branded as ABC. And if you remember or think back at that time of maybe what the multilaterals would have preferred, or kind of how they just responded to, are we just going to tolerate this? Like, what was that like?
Yeah. Well, I mean, the issue, and this is something, that is a perennial issue. It's, not only ourselves, but other governments as well, including, I would say, critically in Africa, also, in a sense, have times where they manifest maybe more conservatively values-wise and other times more progressively values-wise. And so I think I guess I would differentiate, especially in those early days. In those early days, people were very comfortable getting behind, I would say politically, getting behind the rhetoric of, even for the most part, of ABCs, even if practically on the ground that's not how the actual programs were playing out, because because on the ground the programs were playing out more based on what that actual population and that what the interventions look like. And early on, for example, we couldn't formally say the words harm reduction around injecting drug users, because some countries, in Western Europe, use that term to mean legalization and injecting rooms and things like that. That evolved over time, and even in the Bush time. Even in that early time, we were able to move more in the direction of recognizing a public health, and I guess getting people. This is something I did work on with the technical people. If for example, we maintained opposition to harm reduction throughout the Bush administration, but when I first started in the office, we would often, in a sense, cite alternative justification for why that wasn't. And by the end, we were just saying, like, this is our policy, like, we don't support this. And then later it evolved into, okay, like, we do now support harm reduction in these limited circumstances, and it doesn't mean these things that it means in Switzerland or the Netherlands or whatever. But yeah.
When you think about the evolutions, one of the interesting things about this role is you actually hold this across different administrations, and that you've got Bush, and then you've got Obama and Eric Boosby, and I'm curious, did you feel a transition in approach with PEPFAR? What differences did you see, or did you see more continuity than you saw difference?
I would say a lot of a fair amount of continuity, and of course Ambassador Birx as well. Like she actually held it in both second Obama term and that Trump won as well. So I would say a lot of continuity, but also a shift in focus. And so I guess there's this tension, and I'm not sure how much of your other interviewees have gotten into this, but it's certainly I think it's in the PEPFAR of now. I think it's a very relevant question, which is like how far and how long is it right to invest in these kind of vertical single issue type investments versus looking at a more horizontal systems-based approach. That doesn't necessarily resonate in Congress or parliaments around the world. Whereas if you're putting this number of people on treatment or distributing this number of bed nets or vaccinating this number of children, Congress, parliaments can get behind that, but health systems are not necessarily that interesting. But I think that would be one remark I would make, is that I think that Ambassador Gooseby tried to take a more systems approach fairly early on in comparison to, and he did it in a little bit, like some of the training for the health worker training and retention, where of course it would be impactful for HIV response to have more healthcare workers actually effective and on the ground in countries, but they wouldn't be only doing HIV/AIDS, right? They would be doing everything. Yeah.
We've also, you mentioned this earlier, touching on the idea of what accountability looked like in reporting and data.
Mm-hmm.
And we know that changed a little bit with the approach of Ambassador Birx. And
Mm-hmm.
what were some of the things that you saw and what that reporting structure looked like early and how it evolved over time?
Mm-hmm. Yeah. So I think, so I was definitely more tangential to PEPFAR by the time of Ambassador Birx ascending to the Global AIDS Coordinator, although I did work with her when she was the head of the CDC HIV/AIDS office before that. We worked closely together when I was still in OGAC. I think I've mentioned before, I would say that it did move in a more data-driven direction over time consistently. I think that goes. I would say Ambassador Birx is really, in a sense, the pinnacle of that, and I give her just immense credit for the things that she accomplished. But even aside from her, that continuum from Ambassador Tobias to Ambassador Birx, I would say, is very much a movement toward that data-driven approach and less toward the, good luck, Ambassador. See, hopefully this works out. Yeah.
There's also a reauthorization, correct, that
Absolutely.
happens during your tenure there.
Yeah,
And,
yeah.
I think about a lot from what I hear from people who've worked on
Mm-hmm.
the Hill, when
Yeah.
your program is up
Yeah,
for reauthorization.
yeah.
And I'm curious what that renewal process felt like,
Mm-hmm.
if you saw it impacting the way you did your
Mm-hmm.
work, and
Mm-hmm.
if there were any changes that take place that you noticed.
Yeah. So really, for the most part, I would say absolutely, definitely aware of it and feeding into different memos and different kind of brainstorming sessions with leadership on things that related to my work as needed. So I definitely that happened. I think for the most part we didn't really have to. It wasn't so much on the multilateral institutions, because like Global Fund and UNAIDS, both for that matter, had their own lobbyists on the Hill asking for the number, and frankly we just put in the number that Congress put up. So that was an area where we were like, whatever you say, Congress is cool, whatever. Yeah. And so that part of it was good. But in terms of, again, some of this messaging and kind of, I guess tweaking the messaging and making sure that we're getting, full credit in a sense for what the PEPFAR investments are doing, and making sure that you know, Global Fund, WHO, UNAIDS leadership are giving U.S. credit for for that at the time of reauthorization. Those were kind of some of the things, that,
When you think back to those years that you worked on PEPFAR in this office, what do you see and think about as your big successes, those big breakthrough moments for the things that you were working on, or in areas of frustration where you're like, I wish we could have just powered through and gotten this piece?
Yeah. Well, I think I've mentioned a few of them. I was really proud of the work that I did with the vulnerable populations team on harm reduction and kind of getting our policies shifted in a more sort of technically defensible, but also still politically viable direction. I think I'm really proud of that work. I'm also really proud of the work on HIV testing and travel restrictions. We were I was able to get Ambassador Dybel to successfly be the vice chair and then chair of the UNAIDS board during my tenure there. That was really fun to have the U.S. in that leadership role. That's what I was talking about. Another one of the things I was talking about in terms of the like a little goes a long way, where demonstrating that you know, just showing up, the fact that the Global AIDS Coordinator like came to like several of those board meetings, like really empowered and enlivened the UNAIDS Secretariat, as well as made our partners like, you know, sit up and listen more and also feel valued, that like because other countries do send like health ministers and stuff, and so the fact that the Global AIDS Coordinator was showing up was a big deal. So those are some of the things I'm really proud of with my time there.
After you stop working directly on PEPFAR, you continue your health work in other ways. And how has PEPFAR influenced your career trajectory moving forward, and also just the way that you think about public health and its role in global development generally?
Yeah, well, I have actually often said this, and it's maybe a little bit less the case now in 2025. But for most of my career, I've said that all roads lead to PEPFAR in global health. And I think if for many years I didn't know anyone in global health that wasn't from the U.S. that didn't come from, or at least spend some time in PEPFAR. You know, my immediate job after leaving OGAC was to actually, that's when I left the State Department and joined HHS to become the health attaché in Geneva. So I continued to do negotiations at UNAIDS and at WHO and with the other Geneva-based institutions, but from the US mission in Geneva. And I was there for 6 years during the Obama administration with the SDGs and all of that work. And I can say for sure that all of that career was really empowered and has been empowered by my time in PEPFAR, both just the learning, but also just the real bipartisan. I think that's important for people to know that for 20 years, maybe it's not so, it's challenging now, but for 20 years, this has been an incredibly successful bipartisan program that has saved lives and also demonstrated what American values are really all about, I think. So, and it's just been hugely impactful on my career. I can't express words.
You said, it was hard to find someone for a long time if they were in global health that didn't work on PEPFAR, especially from the U.S. And we've heard about that bond that it brings people together who've worked on PEPFAR. And do you think that bond is real, and what does it mean?
Yeah, I do think that, that shared suffering is always a good way to bond. And so the country operational plans. Sorry.
Okay,
I got too animated
about the bond of PEPFAR.
Yes. But yeah, so the country operational plans and getting to know people across agencies and across disciplines, right? Like, people like me who are on the like diplomatic side can talk with like medical doctors and technicians and development specialists, and it's just been a really great experience. I think it also allows you, and I've seen it many times, like people, because of the nature of PEPFAR's work of being kind of a whole of government effort, but we're all in our still separate boxes. Like it certainly allowed me to come here to HHS. I've seen many other colleagues go, from Peace Corps to USAID to DOD or what, there's so many different parts that touch on this. And I think the other thing about it, right, is, and this is the challenge for the future, is that especially for some of the colleagues like USAID and CDC, they've used PEPFAR as the backbone to enable a lot of other development and public health work in the countries where they work that is like knock-on effects, but really, really critical for those populations and those communities.
Just a couple of questions for us before we wrap up.
Sure.
You mentioned a little bit about, the reauthorization that PEPFAR is it's now facing more resistance than it did in the past and has less bipartisan support, as you mentioned. That's one of the hallmarks of early PEPFAR. And from your perspective, as someone who worked in those early years, if PEPFAR is not reauthorized, and what does PEPFAR start to look like if that money changes?
Yeah. Well, I think we have to think about the lives that it touches. There's just real, practical, tangible reality of the lives that would be impacted were PEPFAR to suddenly end in some way. I think, again, that's going to be obviously for Congress and much higher than me to decide, but there really are very significant consequences for people's lives. And I think the thing that we've seen in recent years is that people are interested in looking at what does a sustainability plan or trajectory look like. Countries are taking on, more and more countries, including in Africa, are taking on the burdens themselves in their own national budgets. And I think like South Africa, like way more than 85, they're footing but the vast majority of their HIV/AIDS response bill at this point, and many other countries are working toward that as well. I think people just need to be aware of the challenge of the consequences.
And it's striking what you said of just how the program has evolved, of what the Bush administration started as focused on antiretrovirals, and now PEPFAR provides the backbone of a lot of the different health programming, and so it's striking to see a program be sustained this long and evolve. Is there anything that we didn't ask before we wrap up that you want us to talk about more, that you think is important to share about PEPFAR that we didn't get to capture?
I think we've really covered just about everything that I was hoping to get to talk with you all about. Like I said, it's been the privilege. Is privilege of my career to be able to be a part of that program and to be able to support that work, and it continues to impact me and of course many other people.
Awesome. Thank you so much, Colin.
Thanks.
We really appreciate it.